Thank you, Amila. So after a very exciting lecture, and I have to manage somehow, poor me, it always happened to me. It is keeping on happening to me. Anyway, this is not a very academic thing. Actually, this is basically for junior consultants and the trainees who are going to be consultants, because it's good to know a bit of admin, because sometimes, it's good, you can give a good patient care, not only that, but it helps you to save your own neck. I think that is also very important. Right. When you are becoming an admin person, or if you are heading some admin thing, you have to have some basic rules. So these are my rules, and you have to stick to them. Right? Just any minor crisis can lead to a major crisis if not attended timely. Be impartial. Do not jump into conclusions. When you're angry, you do it. I did it. I'm still doing it, but it's not good. Listen to both or multiple parties, probably in a one-foot platform. So then they can't lie. The other thing is, do not hesitate to take tough decisions if it's really needed to. Otherwise, you'll be easily manipulable. So try and manipulate you, and you might be taking wrong decisions, and you lose your reputation, falling into trouble. Sometimes you can be a joke. So with that introduction, we'll see your position in your department. So you'll be appointed as a consultant or acting consultant ophthalmologist. Acting consultants are legally bound to act as a consultant. It doesn't matter your grade. You will be grade 2, grade 1, or in preliminary grade, but still you can work, legally bound. And you are the immediate supervisor for your medical officers and ophthalmic technologists. How do you find? You sign for them. You sign their OTs, you sign the leave, so they are under you. You don't sign for nurses, so they are not under you. So that's like that. And mind you, you are the clinical supervisor, not the administrative supervisor. We'll come to that later. So your duty, in the hospitals, you have a community duties as well, but in hospital, to function the clinics, theater, and wards. You need to request the medications and appointments and other resources, but finding them is the duty of administrative team, not your duty. But somehow, in reality, so we have to involve with them because it won't happen all the time. A few facts that which might be handy in one of these days. The mine staff issue is a real headache, especially in peripheries. But solving those problems is not your duty. So in-charge sister or in-charge nurse should solve with the overseer. If not, it goes to the administrative officer. If not, it goes to the head of the institution. It's not your duty, right? So still, the nurses, so in-charge sister, then it goes to the matron, again it goes to the institutional head. Are we involved? We are not involved. But if you don't know that, they try and manipulate you, and you have to go and solve these problems. Of course, you can intervene as the head of the institution, or so as the head of the department, but keep it minimal, otherwise you'll be asking for trouble. So other thing is, you can encounter with your colleagues in same specialty or different specialty. So please do not react, right? If you can't solve that in a sort of a friendly manner, inform that in written to the head of the institution. It's very, very important, because if you try to react, you will be penalized. So if he's going to sort of a complaint against you. And please remember, you can't criticize anyone's management in public. That's not, that will be taken as very serious matter. If you do that, there are ways of and means of doing that, but don't criticize. It might cause some problems. And all the disciplinary actions should be taken by the administrative supervisor. So that's the difference. We are clinical supervisor, right? We are like a manager. We are managing our units. We can't blame them. We can't hit them. We can't penalize them. But so everything done by the administrative supervisor. So that is the difference between the clinical supervisor and the administrative supervisor. Talking about disciplinary procedures, because these disciplinary procedures are equal to everybody, even doctors, nurses, mine staff, whatever. So good to know about the bit of a disciplinary actions. So as the head of your unit, you are entitled to correct your members if they are doing something wrong. So do it in a friendly way first. If it's not going to happen, they are going to do it again and again, give a warning, right? See, if you are going to do that, it'll be a problem. If it's not going to happen again, they are doing the same thing, lodge a written complaint, I repeat, written complaint to the head of the institution, right? So then the head of the institution has to do the institutional investigate, right? So they have some power according to E-code, and they will do it, and they will penalize in their capacity. If it's going beyond their capacity, it will go into the ministry. The ministry officers will come, and they will hold ministerial this thing, which is called preliminary investigation, and they can penalize. If the accused person is not happy, they can ask for something called formal investigations. Just know this name, right? Because formal investigations, there will be a defending officer coming, right? So defending officer could be a lawyer, or most of the time, because their expenses are quite high, so most of the time, they are administrative officers or retired directors. So their charges, administrative officers take about 5,000 rupees per one session. So they will, try and argue with you. So if you don't have your backgrounds, grounds, written complaints, if you change your things, then you'll be having problems. So that is why you have to lodge a written, detailed complaint, whatever you do. Requesting medication and instruments, because that's your duty. You can't say, I can't do that. So you have to fill the annual drug and instrument estimation form. Don't think it's a waste of time, right? We feel like waste of time. We ask for them, we never get it. But still, you are liable if you don't do that. So if you don't know what to ask, so when you go to a new institution, we don't know what has happened, you don't know what to ask, you don't know what amount to ask, you always ask your pharmacist, because they can provide with the previous estimate. So you know what to do. And especially, check the balance, previous year. Because if you ask a lot of things, and they are going to get stagnant there, so you have to answer, right? Practically, it might take 2 years. If you ask this year, the things will appear after 2 years. So that's the procedure, right? So we can't do anything about it, but that's the procedure. But time to time, these unbelievable things are appearing in the MSD. So that happens, actually. So because they don't have a proper sort of a system to find them out. If you go to this, what people do, they go to the reception and ask. So they look at the computer, say it's not there. But if you go physically into the MSD stores, there will be things. And if you can't go physically, persuade your pharmacist to go and search the MSD store. So for instance, 2 years ago, I got 6 cataract sets. So it's listed no cataract sets, but I got 6 cataract sets from the MSD, full cataract sets. So likewise. So procurement procedures you have to know, because now the cluster thing is appearing, you know about this. So they are making it one cluster hospitals. You have to cater the surrounding hospitals, not the teaching hospital. So for instance, in Eastern Province, the teaching hospital is the Batikolo. So they have upgraded Trincomalee Hospital as a cluster hospital. Then you just need to get all the instruments and equipments, and the ministry will fund. So then, of course, you have to ask them. You do have to know what to ask and how to ask. That's basically the process of purchasing instruments and machines, There are 2 procurement committees. Center is the Ministry of Health, and regional, you have a regional procurement committee and know about these things. You have to ask from the director and the institution head, they will tell you. And there are 2 types of instruments, high-end instruments and low-end instruments. Forget about the low instruments. We don't deal with them. That's something to do much with them. But high-end instruments are your machines, basically, right? So if you want a machine, request should be forwarded to the head of the institution. And there's a form which is called justification form. And you have to fill it and give it to the regional procurement committee. And there are some allocated machines. For teaching hospital, these machines are allocated. For provincial general hospital, these machines are allocated. If this is not allocated to your institution, you have to give quite a bit of a justification, and you can get the allocation for these machines as well. And it will be passed to the relevant procurement committee, and they will approve it, and then you can ask for the allocation. Allocation, you don't have to do it. The administrative team will do that for you. If you can't, if you don't get allocations, you can't do anything about it actually, right? But most of the time you will get it after at least 2 or 3 years. But still start preparing the specifications. So machines have specifications, right? So that is the most important part. If you can't make specification, it's not going to work. You can't get whatever the machine that you want. You will be dumped with some machine, but not the machine that you want. So actually, I learned this from, trial and error. So I'm telling you, for the juniors, then they will know something about it. When I went there, I didn't know anything about it. So it's good to know a bit of these things. And if you don't know how to make specification, there's someone called biomedical engineer in every region. They will help you. Right? Of course, you can get specification brochures from the companies, and you can study them. And there are set menus in ministry, the set specification forms. And you can go through, discuss with the biomedical engineer, and make a good specifications. You have to have major specifications and minor specifications. For instance, if say this machine has to have this amount of resolution, so that's a major specification. Minor specification will be 13 ampere plug. Right? It looks funny, but those things should be included. Otherwise, you will get a machine without a plug. So that happens. So that you have to be very, very careful in making specifications, right? And make ranges. Don't put one value. So you'll be caught. Otherwise, you'll be favoring, someone will lodge a complaint again to you. You have favored this company. So make ranges, right? So you'll be in the technical evaluation committee. That's a part of the procurement committee, not the main procurement committee, but it will be a part of the procurement committee. So there will be biomedical engineer or MO planning or accountant in some cases. So when you get the allocation, the bid procedure will start. You don't have to worry about it, and they will do it. The administrating and MO plan, they will do it for you. And so after the bid procedure, they will do the administrative evaluation. So they will look at the eligibility. You don't have to get involved, especially this NMR thing. And you know about this NMR thing now. It's very, very famous. And you can't get anything now because they are waiting for the NMR and they are sort of revalidation. Simple thing, you can't get it now because they are very afraid of this NMR thing. Please remember, once the bid procedure has started, you can't communicate with the companies because they might record your talk. So if they're asking anything, say, please ask for pre-bid meeting. That's all you have to say. And if you want to get some clarification, don't contact with them. So go and lodge these things to your procurement committee, and they will do it for you. So bidders, if the bidders needed some clarification, they can ask for pre-bid meeting. So if you don't have good specification, you will really get hammered in that pre-bid meeting. So you have to have good specification. Otherwise, you have a consultant, and the agent from the companies will be teasing on you, right? So once you get the final thing, you have to assess the major deviations and the minor deviations and give your report. Okay, and you can give your previous experiences and colleagues' experiences that may not be that valid, but still it's possible. So financial evaluation, and if the cost, that is now it's 20 million, earlier it's 10 million, the machine is going beyond 20 million, it will go to the ministry and you might have to go to the ministry procurement committee, and that will, after that everything, you will get impressed. Allocation is Denlankasi, impressed is Dunnakasi. So unless after you get the impressed only, you can purchase. You can get the machine. So they will, there's a bit of understanding. They will issue the machine and you have to give it later. So this is the form, just go through it. Working in substandard environment, just few things. Most of the time we have to do it. We are doing it all the time. But if something goes wrong in a court of law, that is not a valid argument. Please remember that. So if you have problems that you're going to anticipate, give it in written to your relevant authorities, either to your institutional head or to the minister officials to safeguard yourself. In special occasions like theatre cases, you are entitled to stop it on behalf of the right of the patients. No, don't do any harm. So that is the first thing. And if someone is pushing, that happens sometimes, ask them to give it in written, and they won't give it. So getting the appropriate card is also very important. When you go to the station, check the card. If the card, only you can't get anything over the card. So that is very important. If you don't do it, the next person is going to happen. So card revision happens every year. Please give your input and help them to get the card revision. So in advanced situations, the ministry has the power to mobilize or to hire. So we had a problem in Trincomalee district. Now they have hired on daily wages, minus staff. So like that they can do. So when you're sending the letters to the ministry, please try and maintain the hierarchy. You can't straight away write to the secretary or DG. It should go through your institution head or the director. So it's very important. If you violate that, they won't just throw it away. So that type, I mean, they are very, very particular about this maintaining hierarchy, the ministry officials. And if, I mean, sometimes your director might be angry with that thing, so she might, if you have any doubt, you can take a photocopy and send it to the relevant person. You are entitled to do that. And you can send a number of copies to the relevant persons. That's okay. So that is the basic thing. You go through the director. Likewise, just as a little structure. Last thing, the handling medical legal procedures. That is also very important, because all alleged assaults, accidents, or any suspicious incidents should be informed to the police and the JMO. Right? Any suspicion. If they say, okay, I don't want, but still you have to do that. But later on, because they come and ask problems, I mean, they will be clear problems, then you don't have any support. JMO goes to the court on behalf of you. So remember, you don't have to go to the courts unless they ask for the expert opinion. And all the necessary documents should be handed over to the courts through the JMO, because there are some smart lawyers, they try to get documents in a very innocent way from you. If you give it, you are because JMO won't go to the courts, you have to go to the courts. So that will be a very big thing. So if you don't have a JMO in your hospital, get the help from the nearest hospital. And if you see such patient in the private sector, you have to admit for JMO referral, or if they, I mean, you can't bypass them. I mean, then you have to document it. At least keep a little record in a diary or something, because you don't know what will happen after few years. Within 5 years, anything can happen. After 5 years, it's difficult, but within 5 years, they can sue or whatever things can happen. The last thing is you'll be a member of medical boards of patients with visual impairment. So you have to see that form and be familiar. Otherwise, it's difficult for you to fill in the first time, and it's not fair for the patient as well. So that is the basic things idea within the time frame that I have. I thought it is going to be a little important. So acknowledgements also, those people helped me to with this information. Thank you. That's all.